Good afternoon. I'm Marie Kinsella. I'm the Director of Community Programs at the Partnership for Maternal and Child's Health of Northern New Jersey. I want to thank you for joining us as we discuss the New Jersey Healthcare Quality Institute's Maternity Action Plan. The plan, which complements the Nurture New Jersey Strategic Plan, outlines 4 key areas for improvement that can help improve maternal health outcomes. Today, we're discussing Part 3, Holistic Maternal Infant Health Care. The Maternity Action Plan stresses the need for payment reform to cover high-quality care that views maternal and infant health from a holistic point of view to improve health equity. For our discussion today, we're going to share details about 2 exciting programs centering pregnancy and healthy steps. I'm joined by Tierney Baggetts from Hackensack's Meridian Healthy Step program in Asbury Park, and Margarita Cruz from Alliance Community Healthcare, who will discuss her centering pregnancy program. So what I'm going to do is ask you both to introduce yourself and just say where you're located. So we'll start with Tierney.
Sure. Hi, good afternoon. Thank you so much for having me. So again, my name is Tierney Vatz. I am a licensed clinical social worker and healthy step specialist out of Hackensack Meridian Health. We're located currently in both Asbury Park and Neptune Pediatrics in Monmouth County, New Jersey.
Good morning. Thank you for having me today. My name is Margarita. I am the social worker from Alliance Community Healthcare. We are located at 115 Christopher Columbus Drive in Jersey City, New Jersey.
Okay, so I'm going to jump right in with the questions. And so, Margarita, I'll start with you. What is centering pregnancy?
That is a great question, Marie. Is a group-based model of prenatal care. The patient's prenatal visits are in a comfortable group setting of 8 to 12 mothers formed between 12 to 16 weeks of pregnancy. Centering sessions are held for 2 hours every 4 weeks, increasing to every 2 weeks as the pregnancy progresses. Our moms learn to record their own vitals, weight and blood pressure. In addition, some of the subjects the mothers learn about are self-care, nutrition, exercising, coping with labor and delivery, breastfeeding, and infant care. And at Alliance, we try to bring community partners as well to discuss their services, and we also provide healthy snacks and refreshments to our moms.
Okay, thank you.
You're welcome.
And so, I know that, when we have new programs, there's that implementation process. So I'd like to ask you, how has the implementation of centering pregnancy at your site, how did that go? Yeah. I'd just like you to talk about the process of implementing centering at your site.
At first it was a bit challenging, but now I think it's great. The fact that we're constantly speaking to our moms, educating our moms. They have more awareness and knowledge about about their health, and I think with our organization, having a lot of communication is key to success for our implementation.
I know one of the pieces of implementation is working with the Center for Healthcare in Boston, the Centering Healthcare Institute. How was that process for you?
So normally, Dr. Roberts and our nurse are more, they're more involved in that. Unfortunately, Dr. Roberts is not here today.
Okay, so I can just say a little bit about that. You know, for
Sure.
any site that's interested in centering, the Centering Healthcare Institute, based in Massachusetts, is really a wonderful organization that helps clinics and hospitals who want to start centering programs. They help them. And a process, you know, first of all, they want to make sure that the particular facility has access to, you know, the population, which are pregnant women, and that they're able to provide support, that they have a team that has really bought into the idea of centering, which I know at Alliance, you and your staff have really bought into the idea of centering and know that it is a wonderful way to a wonderful model to offer to your patients as an option. Oh, we now have our Dr. Roberts on. So would you mind, we're going to just kind of turn our program just a little different. Dr. Roberts, would you mind introducing yourself?
Hi, of course. First of all, thank you so much for the opportunity. My name is Dr. Norma Milanes Roberts. I am Chief Medical Officer of Alliance Community Health. It is a federally qualified health center in the heart of Hudson County. I am also a board certified OBGYN, and I have been in this healthcare journey for over 2 decades now, almost 3 decades to be, if I wanted to date myself, which I don't. So thank you so much for the opportunity.
So I was just, we were just talking to Margarita about centering pregnancy. So I'd like to hear from you. When you hear, you know, I know that you were involved in centering in another facility. What is centering pregnancy, and how do you feel it has impacted or it can impact maternal outcomes?
Well, centering in pregnancy is a, let me just back up a little bit. I believe that we are at the most important time in women's healthcare that we've ever been. And if you've listened or heard, our vice president actually put out a whole plan to improve maternal and child outcomes, especially for minority populations. And so in that context, that's where I see centering pregnancy being the premier way of providing this kind of intervention. Notoriously and progressively, the morbidity and mortality for this particular specific maternal mortality has increased tremendously, and very few interventions have actually made a difference. Centering is an innovative way of providing care. And I say innovative because for us OBGYNs who've been doing this for quite a while, it was something that was not what we were taught to do. And so it innovated because it provided health, maternal care in a community type of setting. We are likely to learn from each other when we're given that opportunity to learn from each other. And that's what centering provides. It provides the ability to relate, the ability to talk to each other, the ability to learn from each other. And in doing so, increases what we have been trying to increase for such a long time, which is adherence to prenatal care, improve our maternal and fetal outcomes. And it is a proven factor that the outcome is wonderful. The adherence to prenatal care is better. Fetal birth weights significantly improve. So that's in a nutshell what centering does and what it is for me.
Thank you, Dr. Roberts. Now I'd like to ask Tierney, what is Healthy Steps, And how is this pediatric care model different from the traditional pediatrician's office?
Hi, yeah, so that's an excellent question. So just to provide some background on the Healthy Steps program, it is an evidence-based model, and it does place developmental specialist and licensed social worker, in my case, licensed clinical social worker, at the heart of the outpatient pediatric setting. So we essentially work with all families and try our best to meet with all families that have children between the ages of 0, so our newborns, up through age 3 and the time they turn 4 years old. We focus on a number of different topics and concepts. Really, the sky's the limit. So we cover topics such as social emotional wellness, mental health, developmental concerns, behavior, cognition, and also environmental and social needs as well of the families. So it's really a great program because most all families do take their children to see their pediatric care provider anywhere between 12 and 13 times within the first 3 years of life, which developmentally is the most crucial age for development or range for development. And so by bringing Healthy Steps into the practice, we're building really strong and consistent relationships with families. We're developing great rapport with the parents. And we're able to have these sometimes difficult conversations with them, you know, and again, including a wide range of topics that we do cover, really all there within the well child visit itself. So essentially, once the children come in for their well child visit and they're meeting with their pediatrician, we do what's called a warm handoff, where the pediatrician will provide education and a background on Healthy Steps and what we do, and essentially hand the patient and family visit off to the Healthy Steps specialist. At that time, we kind of go in, we provide our own introduction to services, we'll review screenings if they're available, and talk about the services we're able to provide. At that point, we sometimes have visits with families that range from 5-10 minutes to sometimes 45 minutes to an hour, depending on the need. And so it really is a very unique program.
Thank you so much, Tierney. Both these programs sound very exciting as we look at new ways of care to offer to our community residents. So this question is for all of you. Is it difficult to enroll families in these programs? And what is the biggest benefit to the families? You know, as you're enrolling them, how are you able to promote the program? So anyone can start. Is it difficult to enroll families into the program?
Sure, yeah. So I can jump in first just to speak to the Healthy Steps program. I wouldn't say it's difficult to enroll families. Actually, we kind of have a mentality of more so opting out as opposed to opting in. So when our providers and the practice, including myself, educate the families on Healthy Steps and the services that are available through the program, we give the families an opportunity to back out or opt out rather. If you choose not to see me, you know, I'm not offended. That's okay. I just want to educate you and allow you the opportunity to understand what we have to offer. And you can certainly follow up with me upon request or things of that nature. But really, we consider all families that participate and attend the practice regularly and have communication with the Healthy Steps specialist to be enrolled in the program. So it's a pretty simple process, and we really have not had many challenges in that sense.
Okay. So I'm going to ask Alliance.
Yeah, we may make the same process. At one point, the idea was to select the patients who would actually be members of the group. But that was not a very good process. I think that given the benefits and the proven improvement that we see across the board, we do also follow what Tierney was saying, the opt-in process. And then if we see that the patient is in need of more of an individual type of care, or if the patient chooses not to participate, there's still that that mentality that this is not real prenatal care because it's done in a community-based type of setting. Then the patient is given the opportunity, and if she wants to back out, then that's fine. But 9 times out of 10, most patients choose to stay and do derive, you know, the benefit that is intended. I don't know, Margarita, what do you think?
You're on mute, Margarita. You're on mute.
Yes, and I would like to add, Dr. Roberts, that, the fact that, we have many variety of different medical departments, we're constantly promoting our program, we're constantly speaking to the patients. So that makes it much easier at Alliance too. So the patients are always aware, we're the nurses, the doctors, the social workers, we're constantly speaking to the patients about this program. We have brochures in the center, so it definitely has made our process that much easier.
So both of these are very innovative programs. And so when we think of an innovative program, a new idea coming into the community or into the medical setting, there are usually barriers. There may be barriers or challenges in implementing these care models. So I'd like to ask you about any challenges or barriers and how you overcame those. So we'll start with Tierney and then move on to Alliance.
Sure, yeah. So, I mean, again, in rolling out the process and introduction and healthy steps into the pediatric care model, we haven't had too many challenges, very luckily. But I would say some of the biggest barriers really have just been adapting to the workflow and kind of incorporating two types of disciplines together, right? There's the social, emotional, social work side, and then there's the kind of healthcare and ped side to it. So just kind of working through ironing out very minor wrinkles in terms of, kind of timing with the workflow, making sure we're not holding, families up too long when we kind of do the warm handoff, that we're kind of scheduling appropriately. We also have adapted some new screenings and questionnaires, developmental, social, emotional, family needs questionnaires into the pediatric practice as well to screen for other needs other than just developmental and behavioral. So that's been another piece to it. And just really figuring out how to really make that work. So, open communication with the team is obviously very important. We've also hosted lunch and learns really to educate the staff on the benefits of the program. Certainly when we introduce any new program to any practice, right, there's a lot of questions. Who are you? What do you do? Also having to be very mindful about our language that we use and making sure we're all on the same page, in the sense that when you sometimes tell families or parents, there's a social worker here that wants to see you, that can sometimes have a negative stigma attached to it based on, specific experiences. However, if we're saying the healthy steps specialist or developmental specialist would like to meet with you, that tends to be received a little bit differently. So I think we've worked through all of these challenges pretty well as a team.
Okay, thank you. So we have a couple of minutes, like 2 minutes. So I want to know, Alliance, you have 2 minutes to talk about challenges or barriers with implementing censoring pregnancy at your site.
I think we at Alliance have been very fortunate to get senior management to be involved in, our to be actually on board and pro the censoring program. And that helps because if you have the buy-in from administration, then the process of implementing it flows a little bit easier. Nonetheless, I agree with Tierney in the fact that we had to, and we continue to educate our staff so that they can also be promoters for the program and constant advocates for the program. The patient, the providers as well, changing that mentality that had been ingrained in all of us for such a long time was not an easy process in the beginning, but towards the end, especially when you do have that outcome and you look in comparison one to the other, is definitely an improvement. It is definitely an ongoing process, but for us, we've been very, very fortunate here at Alliance that our senior management is on board, and it has made the process a lot easier.
Okay, so we're really out of time, but this has been a very interesting discussion. I want to thank Tierney, Margarita, and Dr. Roberts for joining me today. And I urge all of you to read the New Jersey Healthcare Quality Institute's Maternal Action Plan, which you can find on their website and in the link below, of how you can help advocate for changes necessary to ensure birth outcomes. So our live sessions end tomorrow with part 4. Thank you again for joining us.
Thank you so much.